like the thing was down.
But then I went and turned the key, so it's open.
We don't know
So
what
it's
they're
not
They gotta do an evaluation, I think, on the 25th or something.
Okay, hi, how are you?
Good.
Hi, Bob, how are you?
Oh, not too bad.
25th, next Wednesday. So we might be losing the
You
money.
did?
But I just went on vacation. We
You
are,
moved it.
Bob, you wanna be still with us?
we are on,
No. Good.
I think so.
Great. We're ready to go?
yep, we're on.
Okay, I'd like to call this finance and legislation meeting to order. Ms. Goman,
Here.
Dallas Beasley's not gonna make it tonight. Bob Burnside's here. We have a couple speakers here to talk to us. We'll just go in order. Ms. Kristen Omi, Lena Ismail.
She is almost here.
Okay.
We're waiting on her.
Okay.
I'm just.
Is this a combo of all three?
Yes,
Okay.
and I'm not gonna say anything unless you guys
And
have
you're Mr.
any
Zeppo?
specific.
Yes.
Bob Burnside, nice to meet you. Thanks, welcome.
Do legislation first?
Huh?
You have to do legislation first for waiting?
I guess, yeah, okay, we'll do legislation first and then we'll have you guys speak, okay? So, what did we decide to do with this?
Table it? It's up to you and Lori, though.
Yeah, we're kind of,
Okay.
I think we might wanna wait till after we do executive session next week to talk
Okay.
about this.
That's
So I'm not even gonna bring it out tonight.
Okay.
Alright. So we have an ordinance appropriating the sum of $1,000 to Youngstown Class B Baseball, Inc. for the outfield advertisement sign for the city of Struthers for the year 2026 and declaring an emergency. Any questions or anything for that? Need a motion to bring it out,
Make a motion?
and I will second that.
Do you want me to see if I can get, if the guys can get here tonight?
You guys.
The wastewater,
Um,
because I know there's in a time crunch with this.
there's time crunch for everything. We got when's the budget have to be passed? By the end of this month?
So, next week,
No, by
Or
the
end of-
last day of the month.
March 30th.
March
31st.
30th. We only have one meeting left of this.
I
Okay.
mean, it's here,
Yeah,
and then you have all the time to talk about it, and you can bring it out right before the meeting, if you
Okay.
want.
all right, this second piece of legislation is an ordinance appropriating a sum not to exceed $500 from the 2026 general fund budget appropriations, 9,000 miscellaneous category contingent, number 1009000530024 for the city of Struthers, year 2026 Easter egg hunt and declaring an emergency. Megan, you gave us some
Receipts, yeah.
receipts. Okay, motion to bring it out?
Motion to bring it out.
Second that.
Good job on this, Megan.
Yeah, very good. And the last one is a resolution confirming that the mayor and auditor of the city of Struthers shall serve on the Mahoning County Tax Incentive Review Council, TIRC, for 2026 and declaring an emergency. You guys wanna talk about that at all? It's
This
pretty
is
routine.
every year.
Okay.
It's the same, we have a meeting,
Friday.
Friday, next Friday, or this one, next Friday.
All right, motion to bring it out.
Motion to bring it out.
I'll second that.
Hi, guys. Is this the right place? Looks
Yeah.
like it is.
You could, wherever you want.
Wherever you like.
Okay, so, and we each, the budget is coming out, each of us will have that.
Mm-hmm.
I'll just have everybody take it home, look it over.
Yep.
next week, maybe come in a little bit early, we can talk about it if we have any questions on
And
it.
then you guys could reach out to me individually if you have any questions.
And then,
You can
then we could bring it out in caucus if everybody's okay with it, so that's what we'll do about the budget.
Do you want me to bring up, cause there's only a couple of things on there, do you want me to,
Yeah, like
Talk
some
about
big
quickly?
changes,
Yeah.
yeah, if there's changes, that'd be great,
okay,
I'll have
it's
to
a quick,
sign
it's
it.
quick, it's nothing.
Oh, yeah, I guess you do.
So on there, on the budget,
No, okay.
we talked about doing the $25,000 facade grant again, we haven't done that in 4 years. We did that, we have 6 different businesses that we were able to help with that money, so we wanted to put that back in the budget, along with the senior van. There's a potential of another grant that we're looking at through Direction Homes Ohio that we talked about 5 years ago with them. So we're hoping that we may get a little grant from them to offset our part of the cost, but that is also in there. And then the other thing on there is the raises across the board. We went with 3s across the board, so your typical raise there, except for 2 different spots. The only 2 spots on there were Mark Brenner. I think we did a flat 2,000, and that's just carried over from last year's discussion when we wanted to give him a bigger bump. He is severely underpaid for the job that he does. And I remember last year we said, can we split that up and do 2,000 this year and 2,000 next year? So that's the bump there. And the other one on there is we just got done with our union contracts for police and captains units. So Roddy's on there, I think it's a 6% bump because we have to keep that separated from the captain's budget. So we'll be doing that again. We're gonna be doing the contracts for fire and wastewater at the end of this year. So we'll be doing the same thing with the fire chief next year, just to keep that gap there. But other than that, everything else is the same.
For the capital improvements, there's a large amount, and that reflects the adult use cannabis money.
Mm.
So it's general fund money, it's money that comes in and can be used anywhere. But I think some discussion was had, and I had a conversation with Dallas where he said that you guys might like to see a specific place where you could, kind of see what it's spent on specifically. So that's why that capital improvement line is inflated.
So we can use that,
So you can, have
You can see
better
where it's going.
okay.
control over, seeing what it's spent on. It is general fund money.
Kat, the facade, grant, is that for targeted areas or for citywide?
So it won't be citywide, it'll be everything excluding downtown again, because we're still going through the monies that, so if they were offered the money from the CIC, we're still in that process. So this year, they won't be able to be eligible for the facade grant, it'll be every other place in the city.
Cause there's,
Because we feel those grants
some,
were pretty significant.
businesses that they're in the city, but they're not connected to the downtown are interested in.
Right, if they weren't offered any facade money through the CIC for the downtown improvements, then they're eligible for this.
So they
What's
have to
what are we-
contact your office.
So we're gonna roll out the whole program like we normally did. We did it 4 years ago. There was a couple things that we wanted to kind of fine tune with Chrissy and Michelle, as
It's
far as how they're,
processes and
yeah.
controls.
that we're gonna change. And you guys will see that application as soon as it goes out. We'll
So
put it all
where
over social
are
media.
this year, where were you targeting, what area?
We're not doing a specific area.
Oh, you're not?
No, so last time we did it, we were able to help 6 different businesses. We match up to $5,000, so they have to spend
Right,
$10,000
right.
to get the 5,000. Some of them didn't spend the whole 5,000, so we were able to help 6 different places. But we tried to split it up last year throughout the whole city. So we had one on Broad, we had one on Walton, we had 2 on Youngstown Pullen Road. We try to spread those out, but
'Cause-
really it's not a specific thing. We go based off of their grant application, and sometimes if they're a nonprofit and they're eligible for different grants, we kind of take that into consideration, or how big the project is, how good of a community partner they are, different things like that. So we have a lot of things that come into play when we select
Okay.
who that's gonna go to.
Okay, I'll talk to you after that, and I'll be more specific.
Okay, that's
Thank
fine.
you.
But we haven't done it in 4 years, so
I know.
that's one of the things
I
I
know.
really wanted to bring back, cause I think it helped a lot.
Can businesses that did it 4 years ago reapply?
Yes, but I don't know that they'll be given as much consideration as
Okay.
others. They can, I don't wanna tell them they can't, but that'll probably be taken into consideration. They already received a grant 4 years ago.
Okay.
Now, if we did this every year, that would be
Yeah.
great.
Right,
That would be a different story, but.
okay.
But those were the only changes that we had on there. Everything else is pretty much
Okay,
the same. But if, again, like Kirsty said, if you guys have any questions, reach out. We can answer them before the meeting, during the meeting.
do you guys wanna meet like a half hour before next week's meeting?
Do you think
and-
half
and
hour
talk?
is enough, Bob?
Well, if you have it all week and you can look at it,
Yeah,
I
as long
mean,
as we look at it.
do you think we need more?
I'm just saying, it's just, we're getting down to the wire, and if we need to ask questions over stuff that we see the half hour
Then should we
before, how
have
we
a,
gonna?
should we have a workshop before the next week then?
I would
I would
like,
just say if there was something that needed to be changed, like, we would need to be able to have enough time to actually prepare, you know what I mean? It wouldn't be hard, but to go in and change it and reprint the document to have it
Why don't we look it over
ready, so.
the next 3 days and then decide if there's quite a few things come up, Monday or Tuesday we can do a workshop?
I would think a workshop would be
Okay,
the right thing to
I
do.
mean, totally up to you guys.
When's a good day for everybody to do a workshop?
Tuesday, we're filling eggs at Mothie, I think.
And I'm unavailable every single day next week. I
Well,
just
for council
scheduled
though, but isn't
I know, but
Tuesday,
if there's any questions or anything that you have
well, we
for
can
me.
call Chrissy. Whatever day, I'm flexible.
Monday? Okay with Monday? No?
Work.
Yeah, I have plans Monday.
I'll be in Gerard.
So it looks like we don't have anything
I mean,
till
that's really hard.
Wednesday.
I'd rather come at
Do you need,
5:30
like-
next Wednesday.
They
I
gotta
know.
give us 45 minutes plus, all of our caucus time,
Yeah.
provided we don't have any speakers coming in next week
Yeah.
or anything like that. I mean, conceivably, we'd have an hour and a half.
That's what I say, Wednesday, 5:30.
Yeah,
Yeah, Wednesday,
Okay.
5:30, and then that way there, I mean, if I foresee, if I think, I'd probably give you a call and,
Okay.
kinda heads up
okay,
with that.
so look it over and then we'll,
So anything that would change, saved in the computer, I could just quickly change it, right, Megan, just print it out and.
5:30.
yeah,
Yeah,
Very good.
5:30. That
next
works.
Wednesday. Okay,
What day?
28th.
Is anyone gonna want a copy of the amended budget from?
I think I have mine, but I'll let
I have.
Yeah,
mine.
please. If you even wanna leave a couple copies out this week, I can grab it.
Well, I'll make some after.
Okay.
Lord. Next Wednesday's the 25th.
Oh, it is the
Was it
25th?
25th?
Yeah. And then,
Thank you, Bob. Jim, you're on the ball.
For once.
Yeah, we're requesting an executive session next week as well.
yeah, okay, so then we'll address this other piece of legislation after that executive session.
Who's bringing
fine.
dinner?
I was gonna say,
Who's bringing pizza? We're gonna have to all pitch in for some
So-
pizza.
Okay. Anybody have anything with the, ordinances and resolution?
No.
No,
Okay,
but,
so, yes,
I don't have anything with that, but I had talked to you guys about someone coming in and talking to us about the
Front yard.
turf.
Turf.
oh,
And he said he could meet with us like April 1st, but Mayor said she's not gonna be here. But we could pick a day, so if anybody, do you know when you'll be here for, cause I'm sure he'll wanna talk to you too about, if there's, and I think it would be best on a night like this, like a committee night. I did reach out to him, but he didn't answer me back on like what would work for him.
That next one, the 15th, if you guys are available, it's after Easter.
The April 15th? I'll ask him about that,
Okay.
and then I'll let you know, and we'll see, but that might work. I mean, it's not something we have to do right away anyway, so as long as, he just wants to come in and talk to you about different things.
Send him that picture.
Oh, yeah, that was cool today when, yeah. And then the other thing is up on the north side, there's a house that the roof's coming in, I believe it's 93 Highland. Are you guys aware of that at all or
I'm
no?
not, but I'll
Okay.
check it out for you.
I'm not sure if that's the exact address, it's on the corner of Highland and Woodbine.
Okay,
But somebody reached out to me and
I'll
said
take a look
that,
at it.
yeah, I think it's like,
Which house is that?
I think
Is that
it's
Drive?
vacant. Is it somebody's house, somebody lived?
I don't see it, I don't remember, because I drive there every day.
It's a white
Is
house.
you sure it's not Oakview? If it's Oakview and Highland,
Maybe it's Oakview.
the last street, like where Highland dead ends,
I don't know for
that's,
sure. Was that Diane's house?
mm-hmm.
Oh.
Not Diane?
No, across the street.
Okay. I'm not sure. They thought the address 93,
Alright.
so,
I'll talk to you about it.
okay. Thanks.
You wanna do that now?
Yes.
Okay, I know we've been getting some questions from the school about having Civics Day. We've done this now I've been involved for 6 years. We've been doing 2 different things every year. So we've been doing the Civics Day with everybody, all the elected officials, and then we've been doing another thing with, Kevin Daly's government class with the juniors at the high school. We've just been calling it Government Day, and we run them around the city just like we do,
For civics.
for Civics Day. We talked about, I'm having the Government Day this year, April 24th, and we wanted to kind of see what you guys thought about doing, kind of bringing you guys into the Government Day. I know Mike was there last year for city council and having you guys there in the morning. So from like 8 to 9, being with the students, there's usually about 10 of them. And these are kids that are asking to be involved in the program. So I feel like we've really gotten away from Civics Day and the whole voting for the president of council, voting for met with the school a few times, and sometimes the kids are told the day before that they're doing this. We're okay scheduling it, we just have to figure this out fairly soon with the school. I know I was even talking to Mayor Zup on the way to Columbus last week, and they have a whole process where they do at school where they vote they campaign as if they're running for these, and I know that's what we used to do when we were in high school too. So we kinda wanted to see what you guys wanna do, if you wanna go through, the whole Civics Day, and, cause Megan does a great job doing that, or if you wanna kinda see what this is like with the Government Day and be there. We can even bring the kids in here, to talk with council. So kinda just wanted to have an open discussion on what you guys, cause it's kind of,
It's probably better to combine it.
That's, I say combine,
okay,
Yeah, because we also have jury trials that are going on.
Yeah.
And we have our state auditors here, so we
Yeah.
have to make sure that we give them ample time to make sure that they find a different workplace to go to.
So how would you do that?
so normally what we do for the Government Day, we have a panel of 5 or 6 people in my office, we stuff everybody in there, everybody has time to talk, we try to show the kids all the different departments that city government has to work with, so it's not just about the mayor's office, it's not just about this, it's different. Mike came last year to represent city council, we had Mayor Tedesco was here from Camel, Mayor Manuel has been on there before, Jen Johnson, we had somebody from the unions, so we kind of try to show them how we have to there's so many different entities that you have to go with. We brought them to Eastgate last year, we brought them to the Board of Elections, they were down at the court, we really whipped them around all day. We have Donna Vito's provides the food, but the food is ready to go when we get there, so we have 15 minutes to eat. Then we go to Sala's to have cake, so Brian can talk to them about entrepreneurship. We come back here, kind of show them what's going on in the city. We have Bart from Integra is going to show them what's going on with the kayak ramp. So,
I like the fact that it's all local.
we try, yeah.
I
We
mean,
try to show them what's
cause we always have a
here.
hard time finding
Yeah.
places to go.
Yeah.
But that sounds a little better.
So I don't know if it's something that, if you guys wanna be here in the morning part of it, when we're here at City Hall, we bring them around all the offices too, to show them. During court, we sit in Judge Malone's court for about 15 minutes, but when I tell you, we go like fast. So I don't know if that's something that you guys wanna be here for the morning part of that.
What time does that start?
8 o'clock. So we're usually out the door here by like 9:30, so we have donuts, coffee.
I wouldn't be able to get here till about 20 after 8.
That's
I'll
fine.
be missing the first part of
So we're
it.
saying just till like 8 to 9:30?
Yeah.
Probably.
Everybody okay with that?
That's a Friday, right?
That is a Friday.
Jeez, you are good.
Where your human calendar over there.
No.
You're on fire tonight.
Okay. So,
And that April 24th
okay,
is the date.
yeah,
for that.
April 24th.
And you're more than welcome to tag along with us. I know we fill that senior van with the kids.
Okay.
But if you wanna drive a car, go from place to place, you're more than welcome to come with us.
Okay. All right, so you have the budget, look it over. We'll meet back here at 5:30 for a little budget workshop before caucus and hopefully get it and then bring it out. We have to pass it. So, anything else for this committee? For legislation at all? Okay, we have some guests here that's gonna speak. Who wants to speak first?
I guess I will, thank you for volunteering me. I have a dump drive, I don't know where it goes or if we can use it. I
You
can,
know
I
how to
can.
use this thing? Cause she's
Is
got
it
this,
smart board?
yeah, she's got it ready to go.
This is probably just something on the table.
Oh, that's probably for my keyboard. Let me see.
You know what, there's a little box there.
I think it might be into the computer doc.
Oh, moves, you guys have some space to try
It
and
might be on
figure
this
out
side.
tech.
While they're doing that, do you wanna explain to them? I know you already talked to council about.
Sure, I mean, so I was just going to, what you're gonna get,
Is it on the other side?
I didn't want them to not be
Sorry.
What you're gonna get from the Quick Med is the presentation on the
Well,
med
we were supposed to do them first.
what the facility would look like, what it would do, who they would serve. My role and goal was to just say, you know, what we would like from council as KO is just if you are interested, we will start to pursue grant funding to pay for it. There's gonna be 2 phases that need funding. Phase 1 would be your capital needs of wherever it's gonna be located and your equipment needs, because the city would own it. And so you're gonna get, those are gonna be a lot of your long-term questions. We would also then be looking at how to fund the operational side. So because I know your first question is gonna be, this has a pretty large price tag, how are we funding it, right? So we're already, what we would do is, if this is something you, after she presents, you talk, you mull it over the next couple council sessions, if it's something you want us to pursue, to build a funding plan and feasibility and research, how do we fund it long term, that is something we will do. We've already identified health and human services funding that would help fund it operationally. We would ask for operational dollars out of the state operating budget next year under the Department of Health. We're looking at some national health foundations, specifically Bloomberg Philanthropy. And so, you know, my comments to you this evening would be that, you know, we would just need, if you're interested, then KO can start to more strategically use some resources to apply for grants to fund this project. You know, we've been successful with other things, but we obviously don't wanna actually put in grant applications or pursue funding if there's no interest in doing it. So from my end, it would just be, if you come up with if you have some sort of like, well, okay, yeah, let's allow them to dedicate some time and resources to pursue funding dollars, then that's what we would do. I think that there is, absolute feasibility to fund it for year 1 and 2. My concern is long-term funding for a number of reasons. So that's why we would need to do feasibility, we would need to run some data sets, and we do this in your grant metrics anyway, you probably just don't even realize it. Like when you come and want something new funded, is it gonna have a long-term cost associated with it? Is that long-term cost gonna be something that the city can take on within your general operating revenue? Or are you gonna have to generate long-term additional dollars? We consider those things when we apply for stuff. So if you ever are also, this is a good, since I have the floor, if you're ever like, why didn't they go after that? If it's a grant that we know after 2 years the funding is gone and you have no capability to replace it, we don't necessarily go after that grant. So if you ever see another municipality, we have those discussions and we run like, okay, are they gonna get this funded then in years 3, 4, and 5? If the answer's no, and we don't have the general operating revenue for you to assume it, that's sometimes why we don't go after grants. Cause we're already running those metrics, because we know from municipalities, if we get you a grant, that then in year 3, you have to come up with, $500,000 to continue it, that may not be something you're interested in, right? So we have to already run the data metrics as we're going along. So for this, I believe that there is a short-term and long-term outlay. Short-term, years 1 and 2, I think that's going to be fundable. I think we've identified some good resources. It's the long-term, I wanna make sure that there is a plan for how does this work for the residents here in perpetuity, right? So that is where it's gonna take a lot of creativity and additional long-term funding. But for my purposes for today is just after you go through the presentation and hear what they have to offer, and I think there's probably going to be, some questions as we go. But then if you have a very serious interest in, hey, let's pursue the funding, if we get it, then, that's our pathway, then we're comfortable starting to look at that. So my interest is just, we always wanna make sure council's on board with a major project, major funding, in addition to the mayor.
Is this additional cost for your services?
No, it's just rolling in, that's a good question though, in the sense, we will be shifting some focus. So it may be a, extra dedicated time that we might have been spending towards like a wastewater project per se. Some of that time may now be assumed on this, because under our contract, we can only get so much work done per month. So that's kind of why we have to gauge, how do we prioritize what the city wants us to seek funding for? So if you are like, we're very interested in this, we would like it to become within your priority rotation, then we would do that in addition to anything else we're already doing. Just we wanna make sure that it is a focus and priority for you. We don't ever chase down something that is not a viable priority to everyone, right? We can't necessarily go after something that's maybe just one person's singular interest. We have to be very strategic with the departments, with what you're interested in time and resources. So that's kind of really my key, is if this is something that everybody's really on board with and wants to do and sees the value, then we'll make it a higher priority in what we're looking at.
Are you able to get funding for long-term? Because if you feel, you've been with us for a while now, and if you feel that we are unable to maintain long-term, then why even pursue it?
Well, I need to do the feasibility. We haven't spent enough any time yet.
But what's it cost to get started? You says it's covered for 2 years, so you did some feasibility.
Well, we
to be
know
able to
it's
cover
gonna roughly be about $3 million.
$3 million for 2 years.
But that includes capital and equipment expenditures that'll be gone after those initial things are paid for. So that the residual's gonna drop a little, depending on, do we position an application to.
So you're just looking for operational grants afterwards?
Yes, and do we position our ask to Bloomberg Philanthropy for 5 years operational? Ask them to, it's a very, I believe this is next generation medical service. So if I were going to pitch to Bloomberg, put an application in a Bloomberg Philanthropy, I'm not gonna ask for your two fiscal years, we'd be looking at like a 5-year outlay,
Yeah.
a very large ask to pilot something like this that solves health access issues in a former industrial mill area of the United States.
So if we were able to get the first 2 years covered, that would be almost like matching loan for future investors.
Right, and matching long-term operating dollars.
Yeah.
So I could do very easy research fast because I know this stuff. But to the nitty-gritty of looking at, well, can we look at long-term regional bonding through the Port Authority if this was something that multiple municipalities wanted to do? Can we put a rider on, like, I am very, like, beyond where most normal humans are. Can we put a rider on the data centers that would help pay for this along multiple municipalities? There's lots, I look at how other states do things too, right? And we actually provide grant services all over the state of Ohio as well. So I also look at what are other regions of the state doing, how are they funding these things, what's possible. So I have a good sense of how we could do this, but I haven't, I'm not gonna waste staff time unless I know it's something you're seriously interested in.
Okay.
Because then I direct the staff. This is the angle we have to research this by. This is the angle of how we need to look at funding this. Because I already have a general plan from a macro level. Now they have to fill in the micro.
Okay.
And also, if this is city owned, wouldn't we recoup something from being city owned?
Well, you're not going to deal with like workman's comp and some of that stuff.
Okay.
So that's part of the finance, but that's also going to take a lot of
So would this be
fine-tuning.
considered like a franchise?
Well, I mean, we'll let you would own it and they would operate. I mean, so yeah.
But it's your
it's
clinic,
a-
and we can get into that, once she's
Yeah,
done.
but my interest is just, if you're very interested in it, and think it has a lot of legs, a lot of value for the residents, of value being first. You also would be first, you'd be piloting it, you'd be able to, there'd also be a lot of marketability in it for getting folks to move into Struthers. Because we'll talk, they'll talk through some of those things as to where benefits would come from over time. My interest is just making sure out of due diligence and respect that everybody knows about the project, wants us to pursue it, and we're all collectively on the same page. Because we work for you.
Yeah.
So, that was and obviously I assumed there might be financial questions, right? How would we do this? What could this potentially look like? That's why I'm here. So,
Okay.
my spiel is done. Unless you
We're
have
counting on
anything, right now. Okay.
Awesome, thank you, that was good. Hello everyone, my name is Lena, I'm the CEO of QuickMed. A little background about me before we get into the background about QuickMed. I see some familiar faces here, but I was born in St. E's, went to Liberty grad, don't hate me for it. In fact, I have to present next week at Girard, and we're rivals, so I don't know how I feel about that. But nonetheless, I'm a Liberty grad. Our first location was in Liberty. They named the track after me, not to brag, but I'm a former athlete. I know Meerkat is too. Amber, my chief operating officer, went to Mooney. We're not going to boo her too hard, but she was also a former athlete and a really good collegiate basketball player. I didn't get to play college basketball. I was forced to go to YSU. I frequented the mosque here in your backyard several times. But one of the reasons why we conceptualized this model is because we started doing it for school districts. So, whether it's East Cleveland, Lorraine, or locally you're talking about, Liberty or Salem, we started doing a concierge models for the school districts. And what we did was we sold them a package where all of their employees, whether they're full-time, part-time, or PRN, and board members, would get free and unlimited access at any of the urgent cares, and that included primary care, urgent care, and everything above the sun. What it did for their metrics was it reduced their insurance utilization for their employees by 20%, and it decreased their workers' compensation by bills at the end, utilization and bills by the end of the year by 40%. And that was just on a small scale. So we began to conceptualize and we said, well, how do we take this show on the road? How do we make it more meaningful for communities, and how do we reduce the cost of healthcare in our ever-changing climate where you don't know if you're gonna have insurance tomorrow, and if you do, you're probably gonna pay double what you paid 4 years ago for it. So we pitched this idea in collaboration with the mayors, and we're really happy about being able to present it to you guys. So I'll get into it. So a little bit about QuickMed. We're one of the fastest growing urgent care groups in the Mahoning Valley. We actually have market footprint here in the Mahoning Valley. So we have 10 locations regionally. We have market footprint, and we're the third largest privately held urgent care chain in Ohio, so yay Mahoning Valley. So we established community ties, which I mentioned earlier. So we operate and we feel like we're a hospital entity in terms of how we make relationships with the communities that we serve. And I mentioned our school-based health centers. What we do now is we don't just open urgent cares anymore, we open urgent care, primary care hybrids. So if you're going in, you can get your urgent needs taken care of, but then we can schedule you for primary care as well. The reason why we did that was because the insurance payers asked us to. They said, hey, it's great that you have urgent care, but why don't you offer some primary care? That's why they're using urgent care. So we said, sure. We started offering the urgent care component as well. 7 days a week are our operations, and we operate evening and weekend. Uh-oh. Okay. So, does anyone here not know what an urgent care is? Because I'm not gonna read this to you unless I have to. Is everyone familiar with our urgent care services? I'll just high level. You cut yourself, you need stitches, we can do stitches. X-ray, have X-ray capabilities. IV fluids, you get sick with a cold, you want a COVID test, you know. You might have visited us if no other time when you needed your COVID test. You might know QuickMed from then because we were running Chick-fil-A lines. So. Primary care, which I mentioned, we offer primary care for all ages. We focus on adult primary care, but we modify our primary care for children as well, especially in our school-based clinics. Occupational health, that's a big one. So we, for employer health, we do everything from pre-employment physicals to workers' compensation to modified concierge models for employers like school districts. Mentioned our community footprint. I feel like I gave the whole presentation before presenting. So what is a community concierge clinic? Well, it's a strategic clinic placed in your city limits that offers no cost of access to your residents, the employees of the city, and anyone that works in the city. So if you're an employer, you get the benefit of having your employees get free care too. It would require a quarterly roster from employers and valid IDs from residents. And it includes the walk-in care, the urgent care, scheduled primary care, walk-in occupational health. It also includes, and what's not on here, it includes telehealth, mental health, and telehealth general urgent care as well. So, community concierge clinic model. I think this was supposed to have little cute pictures. I don't know what happened, but we can just use our imagination. Seamless referral and escalation whenever a higher needs. Anything that can be rendered, and this is important. So you're probably asking, well, what's covered and what's not covered, right? Anything in the 4 walls is covered. So if you have a big giant cut and we sew it up, no cost. If we're running a rapid combo test on you to see if you have COVID or flu, no cost. If we have to send out labs or we have to send you for like a CAT scan, that's out of our control. We can't take responsibility. The city couldn't take responsibility for those costs, like hospitalizations or anything like that. But it is our obligation and responsibility to try to mitigate those things by keeping everybody there if we can. We've grown because of our success rate in mitigating ER visits. In addition to that, any vaccines, because vaccines can be quite expensive and it changes the whole model if you start comping for vaccines, but the health departments get the best rates on vaccines anyhow, so. So no insurance billing required for any participating employees either, which means any employee within your city limits. Workers' compensation, which Kristen mentioned earlier, if someone gets hurt on the job and they come in, you can't force them to use any particular clinic for their workers' comp, but you can tell them where to go for their drug screen. So we would be doing the drug screens, I'm sure, for these employers, like let's take, your municipality, for example. You get hurt, you need a drug screen, or you need like a breath alcohol test, for example. Got to go to the community clinic to do it. Well, by virtue of that, you'll be seen by the provider there for your injury. We bill $0 to your MCO. I don't know who Struthers MCO is. It Minuteman? You know who you guys use for your workers' compensation for the municipality? Sedgwick, Minuteman.
Sedgwick.
So we would bill Sedgwick $0. we would report the injury but bill $0. And that's because by law, depending on the type of injury, you have to report it. But by the end of the year, your premium will be adjudicated for the next year based on what you've spent. So this has been probably our biggest success when we sell this program to employers, because we'll sell the program to like large employers in Cleveland and stuff like that. It's the workers' compensation component, which to your point, you asked, how does this save us money or make us money? This is where it is. And then there's a reduction in lost workdays and emergency room utilization, which I mentioned, and applicable to all eligible city staff, including public safety. Jesus, I'm gonna get it right. Oh. So reduce overtime and improve workforce availability, access to care for all employees regardless of employment status, that's important. So whether you're full-time, part-time, it's a great retention and recruitment metric for employers in your city to hire people in. City operational value, increase population and residency in the city, curb access to care issues within your city, and increased interest in employers coming into your city. Community impact, expanded access to care for underserved populations. It strengthens your regional healthcare infrastructure, and it becomes a visible commitment to your residents and to your employee health. Probably the most visible thing you can do when it comes to healthcare. Just to give you a little bit more data, 2024 to date, we served over 200,000 lives. 2025, we were over 300. We're on par for over 400 this year. And we're as far north as Lorraine, as far south as Dayton, just so you know our footprint. Implementation overview, confirm location and space requirements. You would own the facility, the equipment inside the facility. Like for example, we put an X-ray there, it would be your X-ray. And my understanding is you guys probably want to own as opposed to rent. If you do this, that would probably be your best bang for your buck. And then we would simply come in, staff, and manage it for you.
Rent the equipment, you said?
No, you would own the equipment. The processes, the operations, we
But
would come in.
we also own the liability,
No, because we care for the malpractice.
you do?
Yeah, malpractice is on the individual provider, so that's part of the management agreement. So malpractice, workers' compensation for the employees, we run it in a vacuum. So monthly expenses are broken down here. They include supplies cost monthly, IT cost monthly. We would want to maintain the IT because, again, to your point, you don't want the liability of a HIPAA breach, right? So we would maintain the IT. Electronic medical records, we would maintain them as well for the same reason. Staffing costs, it includes a fractional medical director, an occupational health medical director, which is actually the occupational health medical director becomes available to your employers for questions. 2 to 3 advanced practice providers, physician's assistants, nurse practitioners, 2 X-ray technicians, 2 medical assistants, 2 receptionists, office manager, and management fees, which include the compliance, the HR, the education, all the liability insurances and so forth and so on.
Any doctors involved?
Yeah, your medical director, your occupational, those are both MDs.
MDs?
Mhm. Yep, those are MDs. That might have been the last slide.
And then here too, I would also make the assumption it would say their ambulatory services. What the city is paying.
Not just paying, but bringing
Skip over
people
this
with
slide, this is
headaches
important.
and stomach aches
Right.
to the.
This would mitigate that quite substantially as well. So that's one of the data, when I'm talking data analysis, we would look at that stuff too, right? Because then you're not running those folks anywhere
Far
outside
away.
the city
Right.
anymore. Not only that, the residents may be less likely to just dial and you're the first responder if the clinic is no cost right down the street. So that's, we've got a lot of, when I said the reason I need to do more data,
That would help out so much.
that's, exactly.
What's the, I mean, those positions that you mentioned, those aren't cheap positions.
Well,
Who pays them?
which brings me to my next slide. The approximate cost of operating these clinics, and this is just so you know, this is what it costs us to operate clinics typically, is around $120,000 a month, and that includes the supply replenishment, that includes the salaries, that includes the malpractice, the IT, the infrastructural needs of the clinic. And that would be based on how many, and what we did is we divided it by about how many people you have living in the city, which gives you about, we started at 8 and then we started putting in like supply costs and things like that, so we rounded it would probably be closer to 12. And that would be about $3 million as she mentioned for the 2 years of operational grant funding. And I know it seems like a lot, but I just wanna preface this by saying, this is really cheap healthcare. If you are, we actually just took over a hospital contract for them in Knox County, and they were operating at about $400,000 a month and using the same staffing matrix. So I think that's all the slides I have, so I wanna open it up for questions.
Is this what you have on Belmont as well? Is this the same?
It's
So
not,
those-
it's not a concierge clinic, that's just a regular
That's
urgent
just
care,
a
you can
regular
go in with
clinic.
your, yeah, we don't have any, you guys would be the first, which is really innovative, you'd be the first to do this, we do this fractionally, which means if an employer participates, they'll come with their card and they'll get free care as they come into the urgent care, but say you come in after, you'd use your insurance card. In this particular case, the only time we'd ask for insurance information is if the person didn't live or work in Struthers.
So other people can come to
So if
that.
I'm visiting, cause I'm no longer a resident, and I, need stitches, would go there, but I'd have to.
Pay
You have to
insurance.
use your
Yes.
insurance.
I'd still have
Okay.
access to your Struthers Clinic when I'm visiting my parents who still live here, and then would be able to go to that clinic if something happened.
And obviously it'd be co-pays with you and everything else, correct?
It would be treated like a regular
Regular
patient
doctor.
visit.
And keep in mind too, this is with businesses, so Astro Shapes and all their employees, this would be a tool they can use to entice people to come
Retain,
and work
recruit.
and retain. They can use this as a tool to keep them here and get
And
more
that's,
jobs, more income taxes. which-
and that's also some of the feasibility we would
So,
want
yeah,
to look at.
what if long-term, we fall short of maintaining this? Then it's up to, since the city owns it, then we have to cover the cost.
If you wanted to keep providing the service.
If you wanted to keep it concierge, you might
I mean, I
decide,
don't think the city can afford that.
well, you might decide that you wanna just turn it into a standard clinic or like lease it to QuickMed, for example, because by then in 3 or 4 years, we're probably gonna have, it would be worthwhile for a for-profit entity to come in and say, we'll just treat it like a regular clinic and start taking insurance. I think that would be worst case scenario, but I do believe after some of the legwork we've done just on our personal time, there's gonna be funding for eons, it's just a matter of knowing where to find it from, especially on a model so innovative. But I mean, we can build in contingency plans.
Not only that, there's some functionally really unique stuff we would be able to do with the employer reduction costs on their healthcare. Is there an opportunity for some type of siphoning something from there?
Do you think their insurances are gonna want?
I think that's.
Not that, it
She's
would be
saying
from
the
an
money
income tax level.
or the money we're saving on what we're not gonna be spending in our self-insured dollars for our healthcare, you would,
Theoretically be able to
Over
use
to
it
this.
towards the clinic.
You
There's gonna be
You
a
made
lot
a
of
comment.
numbers.
What's your name, by the way?
Bob,
Bob, you made a comment. You said, do you think the insurances are gonna want that? Yes. Insurances want you to offer free access to care. In fact, they recommend putting in-clinic offices in large factories to avoid having to utilize the insurance. So when insurance carriers find out that an employer has access to free care, their
Like
premiums
that.
decrease.
Yeah.
Premiums decrease.
And with that, so then it's how some other states have done it. I'm not saying that this is what you would wanna do. You could talk to, like, you could look at your corporate income tax, you could look at some income tax, and then say to Astro Shapes, we're gonna add a 10% increase because we're decreasing your medical costs. That's why I wanna do a ton of analysis on how would you pay for this for the next 10 years.
So we have to have some confidence in your expertise here. That's what
I
we're
mean, I
asking us.
certainly hope you
That's
do.
what we wanna do.
is there an opportunity
And
for
we
a call
have.
with the school?
Yes, and that's
We've actually
another,
met with them.
that's another thing, you add in the school
I
piece,
don't remember.
there's other funding for them potentially to come in, how do we pay for this?
You could technically
Oh, yeah.
categorize it as a school-based clinic if you wanted to, if there was
Under
funding
capital.
available. We actually discussed this very same model with Lorraine, And they were looking at their
Okay.
old public health building that they were going to, they wanted to convert it into a clinic like this, and they were going to call it a school-based health clinic, which means the kids obviously would get free access to care, right? But it would also serve the adults.
And and like the designation of school-based health centers automatically, scores with like Health and Human Services, some of the rural health programs to get direct dollars.
And we're considered the Appalachia,
Well, like, so if you're gonna do a community-based clinic, there's a lot of national grants that pay for towards operating dollars for school-based health and stuff. So there's a lot of different avenues, it's just what's right for the city of Struthers, what's right for your residents, what's right for location, and for me too, it's you also, you have to, crawl before you walk before you run. It's also, the first thing is where's it gonna go? Because we have to solve the capital and equipment costs before you cut a ribbon and actually open it. So if it's gonna be for KO, is it year one or the first half of year one, when our clock starts to figure out how to fund the capital and equipment needs first, right? Because you have to have where it's going. Then we have to start phase 2 in to pay for operational. Obviously, we would be doing phase 1 and phase 2 probably simultaneously, but with phase 1 with capital grants and equipment grants, we have to have the address. So if we're gonna do renovations to a building wherever you're gonna put this, we have to
You have to
have
know where it's going.
the building.
When we did, so we were successful in obtaining Ohio Department of Health grants to expand school-based health into Salem and Liberty. And when we did, they ran the operational and the capital applications together.
And these
Are we
facilities
in a
have to be
medical-
certified by the state and things like that?
You get specific certifications which we would handle under our management agreement.
Management fees,
Correct.
okay.
Correct, so we would take care of all the
Compliance.
compliance, exactly, so
Okay.
all the compliance and regulatory things, we would, under the umbrella, ensure that it's complete.
So you mentioned that money coming in is related to workers' comp. When several slides back.
Well, no, what I said was when employers send their employees there for workers' comp, they'll see the immediate savings after a year because we're
Right.
not billing workers' comp anything.
I thought you said that there was some revenue that was taken, you said that's where,
I think that was for outside residents coming in, and they would have to.
outside
outside
residents.
Yeah, like
For other facilities, what kind of revenue does that look like in a month?
Well, it depends on how much volume. So urgent care, primary care medicine, it's a volume game. So when you look at Liberty Urgent Care, which sees about 70 patients a day, it's a busy
Mhm.
location, it brings in about $180,000 worth of revenue every month.
Okay.
When you look at a medium location, like let's take our Warren location, we see about 40, 45, they bring in about 100 to 110 a month. Our break even is around 100, 105. So anything over that becomes, how we can pay our administrators essentially.
Okay, I mean, with that kind of income, I mean, it sounds like it pays for itself.
Well, you'd hope, but it's a volume-based game.
Mhm.
So typically, if people have options, they will always go to the ER. If people have options, they will always go to where it's the most expensive to get care rendered. Or if people don't have options, they're going to the ER as well. So, in theory, what you would say is, well, why don't you just open a regular urgent care, right? The market can't sustain as many urgent cares in this area. It would pull from our other locations. So it wouldn't make fiduciary sense for us or for probably any other entity, frankly, to come in and run it as an urgent care, as a de novo, as a new location. Now, after 2 or 3 years, once there's exposure, that changes the story, right? Now you're already having, let's say, 60 or 70 people come in a day, to Bob's point, and now if Bob's like, hey, we're out of money, Lena, I'm gonna say, I'm just gonna run it like a regular urgent care now. You've done the legwork for me. My fear as a business owner is, what if we don't generate enough bodies through the door? It's like, when you offer, free popcorn at the movies for the first year, and then afterwards you say, okay, we can't give you free popcorn anymore, but people are still coming because the popcorn tastes great. I mean, that's the idea. So I've been pushed and pressured and beat up by Mayor Zupo. He wants an urgent care in Girard. And I've told him, Marizupo, I have an urgent care in Liberty, I have an urgent care in Warren, I have an urgent care in Cortland, I have an urgent care in Austintown. I don't know if it will probably pull from my Liberty location. So that's how the idea came about. How can we give everyone a free sample of the popcorn, at least for the first couple years, and guarantee the bodies in the door, and then we can turn on the insurance model if we have to, because now we know we can sustain with the people coming in the door.
Okay.
I think
And-
that the goal is to kind of put the onus on the communities to take some type of initiative and accountability to gather your communities to use the facility that's provided to you. You know, I think it goes right into what she says, the school-based model operates very similar to this, but on the other side, the families are permitted to go to the school-based clinic, so that model works too, but here, this would be something new, it would be something innovative, and it would be something really for Struthers. You know, it impacts your employers, it impacts your residents. I think you mentioned, Kristen, it's gonna impact the EMS utilization. You know, you're gonna see those costs really decrease. We're talking like $150 less, under $150 a year to have free services, primary care, with the exception to how we handle the employers.
Right, so, cause if you're thinking of it as a resident, you're taking that individual math and saying, for $150 a year,
$12 a month.
$12 a month, I have access now to, because I live in the city of Struthers, essentially all the healthcare services. When I got that sore throat, now I'm going here, because I live in a city that has this for free. So it's also gonna drive, like when we think about young people making choices as to where they wanna live. If you have a family now and you're looking at competitive nature of where, and your buying market is Struthers, Poland, Boardman, and you know that your entire family is not gonna have to pay for healthcare, aren't you gonna maybe choose to live in Struthers? It's how you market it and how you use this model too, as to how effective you could make it. I think that and I spend so much time with a very young staff. It's interesting. My staff is so interested in this project because they want to solve healthcare. Because they're young people who feel the healthcare crisis differently than other generations might, right? So they're like, yes, I'll move into Struthers if we're gonna get free healthcare. Let's test this. They're like, wait a minute, KO, can our business be located there again? Because then we would have access to free healthcare. So it's been my staff is very intrigued by the entire premise of it.
Okay, so we have this facility and it's free healthcare, so to speak. But we can't sustain it anymore, so we turn it into so then it's no longer free healthcare for the residents of Struthers.
Well, there's a lot of different, theoretically, so.
Well, yeah, there's a lot of moving parts here.
Obviously, that would be like the worst contingency ever that would possibly happen. We can't find funding, we can't get buy-in from residents, we can't get buy-in from employers. Then, all things considered, none of those things happen, then we turn it into a regular clinic.
Right.
So to get to your point, yes, but that would be worst case scenario.
Yeah.
Like, you'd always be able to offer healthcare at that point, it just wouldn't be free anymore.
Right.
Well, and we're thinking too, theoretically it could be, we obviously have a long road to see how things play out, but it also could be a ballot initiative. We could use property taxes to pay towards some of this.
Mhm.
But we know there's so much changes right now being discussed about property taxes in the state. That is one model.
Mhm.
To add a millage to if residents wanted it, put it on the ballot. See if it works after so one of my things one of the first things one of my staffers said, well, put it on the ballot. The residents are using it, liking it, wanna keep it, realize it's only $10 per person, let them vote and decide.
Mhm.
That would be an avenue for how to operationally fund some of it. It's not gonna cover that entire operational chunk by any means. We don't have enough residents to generate enough millage, I don't believe, which is why we need to run the data. But we haven't finished the data because I'm not.
Yeah, it sounds
Yeah.
like there's a lot to figure out.
Yes, I'm
Yeah.
not gonna nerd out on it and have staff nerd out on it unless there's an interest.
Right.
How big of a facility you need?
3,000 square feet. I think for something like this that I believe will be busy, you need about 3,000 square feet. And what I recommend is always have room for expandability, because if it works out and you get a lot of buy-in, you might want to might want to add some specialty services down the road, not even for free, just to park somebody there, because you know that you're having a lot of people you're referring to ortho, for example. You might want an orthopedist next door or something like that. So it's going to attract other specialties to come into the city. Like right now, I don't know if you have any Akron Children's assets in the city yet. I guarantee you, if you open this, it'll be an Akron Children's asset in your city within a year. And it attracts, and we have a good relationship with them, it attracts other healthcare entities, dentists, things like that, where we can refer to, because the value in doing this is now the city has a degree of control about where they're sending their residents for tertiary care, right? So you can start basically saying, this is our city clinic. I wish we had an orthopedist here in Struthers. We're sending 100 orthopedic referrals out a week. I wish we had an orthopedist in Struthers. All of a sudden, Southwoods will put an orthopedist in your community. I mean, we open urgent cares because this is our bread and butter. Hospital systems open urgent cares because of the referrals. So you're going to have a degree of control of how you control those referrals.
And for me, we've also already started to obviously think about potential buildings and buildings that would be low cost conversion. You'd still have to do conversion, but one of my interests is Manor Avenue, because it's already in the school district's portfolio. The school district could theoretically give it to the city for $1, and then we would be able to fund some renovations for a couple of the classrooms to use it. Like, I've already been churning, like, how would we do that? Like, what did you want
When we
to know?
build the new city hall, you can have this whole building. Well, ideally, I know when we first.
Absolutely.
But when we first had these conversations with everything going on down at the river with the community center and all those plans, I know we're still talking about that, but ideally, that would be the perfect location.
Well, and you could start with a 3,000 square foot building that we could do a hallway and a firewall, and that starts the rest of your facility. Sorry. I'm also
And that
okay.
location would pull for paying people maybe from Lowville, Camel, and parts of that part of Youngstown and Cape Coral.
Exactly.
That's where those
I mean, you might
partnerships
be able to
kinda
get a buy-in from those cities to cost share, depending on how closely you put it to the border of those cities.
When you say employer buy-in, like they would pay a fee to.
No, that's like a willingness to participate when I say buy-in.
Or even what Kristen had mentioned earlier, she said, hey, if we saved you this amount in this year, can they help, fund the clinic and support it in other ways too? Because there's gonna be a lot of savings tied to this. And I think it was stated earlier, I don't know who said it, but this is truly the new wave. I believe this truly. This is gonna be the new wave of healthcare. Right now, the only competition is the large healthcare systems. And that's just not good enough anymore.
I mean, the municipality is truly taking control of its healthcare. This is a statement that would demonstrate that, and I think that, Mayor Zupo, you were in healthcare, you can agree that when you take control of where your residents are getting primary care, first end care, it's sending a message to the expense of healthcare locally and basically saying, you gotta do better, you gotta do better. We don't need to use, your $1,000 facilities with your facility fee that you're gonna charge the minute we walk in the door, and we end up with a $500 copay after we leave. We have our own healthcare. If you want us to utilize you, come here and meet us where we're at.
I'm gonna say, it's the longest I think I've sat quiet.
Yeah, you were pacing over there.
No, I'm listening. Good salespeople know how to listen, I think. So, I was in medical device sales for 40 years, and the last few years I spent in corporate accounts. And so I dealt with all the corporate healthcare systems in the whole Northeast. So I went as far as Toledo, down to Baltimore, and I can tell you, and I've dealt with all of them. And they can't do this. Their eye is not on this at all, okay? Number one. Number two, I think one of my main attributes is the ability to spot a good idea. I think this is a great idea.
This is a great idea.
And I think I appreciate very bright people, and these are very bright people right here. And Kat and I have hit it off. I've been here for a little over 2 years in Girard, And, we just feel like we're like sister cities. Girard and Struthers are very similar, you know, I have cousins that grew up on Manor Avenue, by the way, you know, so, I think that I've been selling still since I got in this position, I'm just selling Girard. So now I have a great pitch to sell. I'm trying to bring new businesses in town, hey, by the way, we can offer you free healthcare. That is a great pitch to sell to a company. I've talked to some big companies, we made it to number 27 on Costco's top 25. We just missed out, we lost out to Sioux Falls, South Dakota, I'm still having a hard time grasping that. But I'm offering them free land, 60 acres of property, I'm offering anything I can. If I would've had this, it might have been enough to put them over the edge, okay? So I'm not afraid to go after the whales, I'm not going fishing for minnows, I'm looking for whales. And so this is how you get them, I think.
Thank you for the compliment. We love innovative leaders too.
You know, when we, just a little background personally, when I was working at St. E's in the ER, I was working in the ER when Northside closed. And I'm a nurse practitioner by trade, I should say that, I'm a dual certified nurse practitioner by trade, so I'm a clinician. Not a doctor, but I have my doctorate. And Northside closed. And we were getting an influx of folks, and just so you guys know, if you didn't know about Northside had a 95% discharge rate, so they were running a giant urgent care. They were discharging everyone, they're running a giant urgent care. So then St. E's in the ER, we started to see the same phenomena. As soon as Northside closed, we started seeing a 200% increase in what we called our fast track. And that was the urgent care part of the ER. And I knew the chief financial officer at the time, and I said, let's just open an urgent care across the street, there's a vacant building there. And he looks me square in the eye and he goes, we make more money when they come in this way. So about a month later, I started asking my colleagues, I said, hey, you guys want to each put in $10,000? Let's open our own urgent care. And everyone thought it was crazy. Like, we can't do it. It'll never work in this town. I started in Liberty because I was from Liberty and I knew I'd have buy-in from my community. We went to Cortland after that, and then we planned for Austintown and Medina. My ex-husband lives in Medina, so I had to go back to Medina. And COVID hit after that, and we were the first to have COVID tests. We beat the hospital systems to it because we weren't restricted to a GPO. And those of you that don't know what a GPO is, you have to buy from these people. And if you don't buy from them, you don't get it, right? Well, we didn't have that red tape. We were the first to have COVID tests. We were the first to have antibody tests. We were the first to be able to do the vaccinations. And it's because we deliver health care. We're not cutting backdoor room deals with GPOs to make sure we stick with them. And, the moral of why I'm telling you this is because the way healthcare is built right now at the highest level is to be able to make the corporations a lot of money. I'm not saying this won't make me money. It will make me some money. It's not going to line my pockets to where I'm going out buying a new car. It's going to run me a clinic like I run my Warren clinic, or like I run my Cortland clinic. So it will bring viability to the clinic and it will bring free access to care to your community. And I think it meets the marriage of everybody ends up winning on this, whether it's the employers, the entity that's operating this for you, or the residents that live here. Being on both sides of the coin and being part of a larger hospital entity, and then being on the outside and seeing how an independent is treated even with the hospital systems, you recognize, and it's outside of their control, that their intentions and their and what they're looking at achieving isn't community focused. It's really as a broad umbrella to serve the community so that they can generate more referrals and do more surgeries and do all the things. It's a business. For-profit, non-profit, it's a business. But it isn't a community initiative, and it will never be a community initiative unless the community is a true partner, is a real partner in this.
And then I'll just close with my final thought. I'm also, innovate or die, but philosophically, what's old is new again. And when you think about medical delivery for our grandparents, it was doctors who lived in your community and came to your house. So what has happened is over generations, we flipped that model wrong, perhaps. And I think this is the next generation of what is old is new in putting, hospitals were never they were meant for major surgeries. When you need stitches, think about doctor services, when doctors used to still come to your homes in the 20s and 30s. Your doctor just ran with his little kit, stitched you up, and was on his way. So we changed that model over generations to the giant systems. And the giant systems now are seeing a downfall because they weren't meant to take people sitting in the ER because they split their head open and weren't stitched. They're just, so it's, what are you gonna do to innovate to figure out how to recalibrate that? Whenever there's massive change, it's driven by whatever the next great idea and innovation is. Healthcare needs the next idea of great innovation, and it may be back to residential close-based clinics.
700,000 people are gonna lose their insurance by 2027 in Ohio, Medicaid expansion, 700,000 people in Ohio. It's already started. We've seen a 15% reduction in volume because we do about 40 to 50%, depending on location, Medicaid. And that is the 18 to 55-year-old people that will lose their insurance. It's already happening, but we're going to see the big tee-off by 2027. The question is, I mean, do you want them riding the ambulance to the ER because that's what they're gonna do? Or do you want them to be able to have a level of care which can be accessed and makes just financial sense for everybody?
And for us as a firm and what we do believe in our work is you can either sit there and point at the problem or find solutions to solve it. And we, as a community and economic development firm, we wanna solve it. We wanna solve it with our partners that are like, we know this is a problem. Now how do we put Struthers and the Gerard on the map? Hey, we were on the map in this country for steel. Let's be on the, we're already, medical is one of our highest ranked professions in the state of Ohio. We're known for the clinic, it's one of our better, but now let's put this idea on the map, cause it's solving a crisis that no one else is really willing to solve. Here's a roadmap to do it. That's why I'm interested in it. I wanna win a Nobel Peace Prize, right? So that's why am I really in it? I wanna win the economic Nobel Peace Prize. So that's
Bob, you take control of everything else. Why won't you take control of the healthcare of your city?
Yeah, so that's, but I mean, all kidding aside, I think it's.
Use a low, say low level, not having to go to a big hospital in your community. Well, do you know those numbers, like by chance?
Well, I
like-
mean, I can put it in perspective for you this way. That when we opened the urgent cares, the hospital system saw a 15% reduction of volume to their ERs. And that was dramatic. That was dramatic. We became an enemy because of it, actually.
Right.
And I will also tell you that, you know, in terms of our volume, you look at like a location like Liberty, and I'd say Liberty is probably, besides being bigger, I think that the folks that live there are similarly situated to those in Struthers. And generally we look at like the Medicaid utilization of kids in the school district. That's sort of what we look like. That's sort of what we look at when we do it. And seeing 70 patients a day in urgent care is a phenomenally busy urgent care.
Mhm.
It's phenomenally busy. I mean, when you look at like, we have a Boardman location. Boardman will see 25 to 30. It's meh, it's okay, we'll take it. But there are tons of options in Boardman. So it really comes down to that who uses it is directly based on the access and whether or not your insurance is accepted there. So if you have a facility right next door that you know, I cut myself cutting my tree down, and you know they'll do stitches, you're probably gonna go there. You're probably not gonna skip it to go out of town. So it's all access driven and not preference driven, believe it or not. It's only preference driven when you have a bad experience. If you come in and I treat you like crap, you're like, I'm never going, then we get the 1-star review, right? But if it's only preference driven when for some reason you've had a bad experience or you can't use that location. Otherwise it's convenience driven. There's a 3-mile rule to urgent care. If it's within 3 miles, you'll probably use it.
And Struthers is a good tight-knit community. If it works and we know it's working, people are gonna use it.
Right.
Yeah, and that's where kinda I come from too. For the last 6 years, there's so many things that most of us have been together for that we've been the first to do. We were one of the first in the area to get our comprehensive plan, to hire KO, to do a lot of these different things and think outside of the box. We're one of few council administration that can sit here, argue, fight, and get along, and everything still goes the way it should for the benefit of the city. So for me, we're not gonna lose any services from Christians. They're still gonna be going after the grants that we normally go after, but why not Struthers? Why not? Why not explore this and why not see where this can take us? Because if it can, the benefit is gonna be incredible for us to be one of the first again.
I do have a question. Okay, you're talking about the different urgent cares that are in the area. Are they this model, or are they, when you go in, you've gotta have insurance?
Everyone in the whole United States that I know of is you have to use insurance.
Okay, so this would be
The first.
the first.
True first.
Okay,
This would be the
so
first.
we don't know how this is gonna play out.
You don't know how it's gonna be.
Right.
yet.
Which is also what makes you attractive to foundations and funding, because it's a pilot.
Right.
And they always, and so, and it is a catalytic pilot.
Mm-hmm.
So that's why I also think it's we don't often talk about going after national foundations for projects in Struthers, where we think it's gonna be viable that they fund us. I think it's viable that they fund something like this, because if it works.
Yeah, oh, yeah, no, I think it's a great idea. You know, I don't have the expertise that you do, so it would just be a matter of,
Putting contingencies.
doing
in
some
place, too.
research,
Well,
yeah.
and putting contingencies in place, so
Yeah.
you know, if you're running out of funding, what can you do to continue to make the clinic viable?
Right.
And that's how we operate our
Self-building.
business too, so.
Worst came to worst,
Well, exactly.
self-building.
Exactly.
I don't think it's gonna hurt us any if we explore this option. So it's not saying we're doing it, this is how it's gonna be done,
Right,
but exploring it to see how this whole process would work out.
Yeah, I
don't
mean, I
think it
told
would
my
hurt
staff,
us.
look, we're solving health. And they went, all right, let's do it. Because that's really what you're asking, in a sense, we're being asked to do.
What's really scary though is, to your point, with all the Medicare, Medicaid cuts coming, what's that gonna do to the inflation of the cost of the medical for, if, just say in a perfect world, oh, we got this funded and we did this, and our estimate is, $120,000 a month to pay for this thing. When all this hits the fan and this starts to collapse, what's the cost of
You have to
this
bank
gonna
on
look
an
like?
entity to
It's
plan
gonna
for
look like
it,
a
right?
lot.
You know, it's a great
More.
question. You have to plan on an entity to bank for this change. QuickMed banked on this change. I mentioned earlier that we're staffing a hospital urgent care for them. We're going into managed services. So we want to go away from relying on insurance too. Like, we really don't want to be married to taking insurance. So we saw this coming down the pipe a year and a half ago, and we started getting into managed services. Let us manage your clinic for you to hospital systems. Now we've closed Knox. We're talking to Sharon Regional, who really wants to work with us. And so we've mitigated it by saying, let's create revenue that isn't solely based on insurances. That's how we keep costs low for everyone. So to answer your question, we're already paying for it. It's very scary. It's scary, and a lot of people similarly situated to myself haven't planned for it. I'm getting calls from colleagues every day trying to figure out what to do about these reduced volumes they're having in their clinics. We've planned for it for almost 2 years.
The risk reward is outstanding. The risk reward is, we get to be on the cutting edge of something. I'm completely excited about it.
So you're all in.
I'm all in. Is my council all in? We'll find out next Monday. You know?
I'm going to
We're
the
gonna
council
all
meeting
over
on
next
Monday.
Monday, yeah.
Yeah.
I think it's a great idea. I really love it.
Oh, yeah.
I think
really
with
scary.
it is scary, but
It's
I
a
think
risk.
with Medicaid, especially with like 2027 coming, I've had residents tell me that they call 911 when they
Stub their
bump,
toe.
yeah,
Oh,
because
yeah.
they have Medicaid and they get the free ride to the ER, and they said, well, I'll sit there and wait
And
for
then our guys
2 days.
come there.
Exactly, and
And then they
we
sit
and
at
with
the
the
ER
ambulance
for 4
service, how
hours.
we've had so many issues with that. I think once 2027 hits, this is going to be the best thing that we could do.
You can tie in and you can look for funding for this is atypical transportation that is not ambulance to bring people to the clinic too.
I think that would be perfect
Like a
for the city.
I like that.
Sprinter vehicle,
I
yeah.
think that would be
And that's super
amazing.
cheap. It's super cheap. It just becomes like an Uber.
Yeah,
Yeah.
Well, and it spurs other than innovation, spurs innovation.
yeah,
Right, so now a company that wanted to do a concierge driving service
hmm
has an audience.
yeah,
Now you're starting to look at how do we really solve this?
yeah.
And you can even, to play off of what you said, you can ask our guys how many times
Oh, yeah.
they get calls,
100%.
I have a headache,
hmm
or I cut my finger, and they're trying to explain, like you said, they get a free ride to the hospital,
Yeah, why not?
so they take it.
Yeah.
You ask, pull our engineers, ask them.
And
Kenny
Struthers
tells me
can
about all
do
the
so
things.
much innovative stuff, where like all our pizza places put coupons inside of the,
Mhm.
like, because our community has that community knit.
Close knit, yeah.
To where how do we market to drive our residents to use it? Talk to a couple of the businesses that would be willing to be like, yeah, we'll do a free pizza Tuesday if you remember to go use the clinic and get your coupon, or we'll do we could sell that.
I think the kind of the bigger question would be, what could we sell it to bring? What kind of businesses could you bring? Where could you put them?
You're gonna have a problem with people
like,
trying
how
to put
could you-
one person here calling it their business while
Right.
everybody else works outside of the valley. So you're gonna have to put strict rules in
A
about
minimum
like
amount of
who
employees
oh, yeah,
or
people
something like
It's not
that.
gonna be hard to sell it, it's gonna
Or
be
how
hard
do
to
you
find the
use it to
fraud.
entice-
Yeah.
Who is our target to pull in as a potential, business to come here because you have this service now? And where do you put them? You know what I
We
mean?
could do that data, small base manufacturers that have a ton of workers' comp claims.
Right.
But the Struthers is landlocked. Without the infrastructure downtown, we have no land.
Right.
Unless we start annexing, which is also talks down the road.
And you've still got some space inside of Gaslow.
Or you might find in 2 years, I'm sorry.
Go ahead, I'm
You
done.
might find in 2 years that you become so successful that investors are gonna come to you. That's how that's all.
You can only hope. That's all. I like the
That's kind
idea.
of the point. You get them where you put them.
But again, like I said, it's not gonna cost us anything more. It's covered under the contract. We're still gonna go, it's like, it'll be a priority, but it's not gonna take away from any of our other grant writing that they do. We meet with Matthew once every week. We talk to him 20 times a day. I don't see a downside to exploring it. That's all.
I love it.
Well, I hope you guys all really take heed to how the healthcare is shifting. I have to run in a second, I'm just saying, but I am super excited, that's why I'm pacing over here, because I
I
think.
thought you had to pee. I was
No,
like,
Lena and I have been talking about this for probably, I wanna say maybe 2, 3, maybe more years, we've been talking about something similar to this. So we nerd out on stuff like this is why she's the CEO and I'm the little boss. But I really hope you guys consider it. I think Mayor Kat is the perfect person and Mayor Zuko are the perfect people to pilot something like this in this area.
Thanks for coming.
Thank you.
And Kristen, if you get something like this that works for prescriptions, I guarantee a Nobel Peace Prize. Prescription coverage is a rough
Incidentally,
one.
we're working with some school districts on creating 403B pharmacies
Oh, awesome.
inside of their municipality, just very I think on the fringe of it, but
Okay.
The cost, what we pay to get like a Z-Pack, like if we were ordering it to dispense, well, if you want to decide I want to dispense the, let's say, 30 most common meds, I mean, it would be, the cost is immaterial to the value, so you can get like a bottle of penicillin for like $2, for example, or a Z-Pack for like $4. You might decide you wanna, maybe go out and get funding for medications and then stockpile, and we can dispense, as part of our terminal distribution license. So we can actually dispense Z-Packs, we can dispense penicillin, we can dispense, certain medications that way, so we can take the top 20 or 30. And then as we continue to move forward with our innovation, in pharmacy, consider opening a pharmacy that we find a way to fund.
And the solution to breaking monopolies is finding pathways to fill
Correct.
holes.
Yeah.
No one's ever tried innovatively to look at how you start to do this, and this is a pathway. So, we're interested, we just want the okay to, we've already identified some grants that we could submit in April, May, June, July, but we need to know that it's an okay and a priority and it has.
You don't need legislative action for that, do you?
No, we just wanna
I
be
just don't feel comfortable
respectful.
saying without everybody being on board for this.
Yeah,
We could table something that's, go around the table, yeah.
but that would be up to you as well. I don't wanna direct resources if you're like, this is the dumbest thing we've ever heard, no, right? So, it was about respect, bringing you all to the table, keeping you informed.
Thank you.
Okay.
We appreciate that.
Yep,
Good. I have an hour drive and a conference call, so
thanks for coming.
I gotta sneak.
Alright, see ya.
Thank you.
Thank you.
Thank you.
Thanks, Kristen.
Thanks for coming.
And I'll see you guys Monday anyway, Monday. Monday.
Monday.
I'll.
What time Monday?
I'll respond.
6 o'clock.
You guys are free to, if you ever have any questions for me, Meerkat has my contact information. If you have any other problems that you want us to figure solutions out to, let us know. We might not be able to do it overnight, like your pharmacy issue, but we can start conceptualizing how we overcome that. I know the real cost of things, and once I was able to find the real cost of things, it was a game changer for how we conceptualize delivery of medicine. So thank you guys.
I know, I've heard about you, my daughter worked for you, Carly Texan.
Yes.
So, I mean, I've heard what you've done, I've heard people who've come for you, with you, so, I mean, you're bright. You're
You've done
doing
wonderful
things,
things.
you're.
It doesn't always come without scrutiny, which you probably know. But it never stopped us from continuing on and pushing forward and being able to be the first to do things. You're always going to meet resistance, and when you pay attention to who's resisting, you'll know who's losing money. And we're really proud about what we do, but this would be our most proud project. This project would create something, I mean, to Kristen's point, Nobel Peace Prize worthy. This means more than money in the bank. It means creating a self-sustainable Struthers that doesn't need anything else. Once you figure out the healthcare problem, that's 80% of the battle.
Thank you.
So we look forward to working with you guys.
She's an okay basketball player.
Oh, nice, you.
I still play, so I invite Meerkat to come out any day she wants. Any day she wants, she can come out.
Good luck.
Bye now.
All right.
Yeah.
We'll see you.
See you, Mayor.
I do have mine.
Oh, yeah. Oh, yeah, I got it, yep.
Hey, I'm sorry, but we didn't talk about front yard gardens.
Okay.
Talk about what?
Front yard gardens, you weren't here last week, I don't think, were you?
No.
So everybody had their thing, and I think we had a couple questions, to ask Joanne about that. I think, well,
Mine was only about the containers
yeah, we were talking about, that was at the raised beds. So,
and containers.
we don't know if we need to be a little bit more specific.
I'm not a gardener, so I don't know. I mean, I
Well, like, if they were gonna use 5-gallon buckets, or, you know, I mean, what, you can just say on here,
I don't think there should be raised beds in the front yard, period.
I mean,
I think it should just be
I'm
in-ground
fine with
planning.
that.
I don't,
No
if
front
it-
yard, no raised
It should be
garden.
on the ground,
The
no
only
raised
thing I said about the
garden.
containers was, people build those 5-gallon bucket
Yeah.
things, and people will probably put those in their front yard, and is that gonna be considered an eyesore to neighbors, so, or will they just use a clear tote? I mean, I don't know, it just says containers, so it's very vague
Might
across
even
the
be neater
board.
in buckets.
Huh?
Might even be neater in buckets. You know what I mean? Instead of having weeds and everything else, they have buckets and it's, you know what I mean? Think about that.
Oh, yeah.
what did you say, Ricky?
It'll look neater. I mean, there won't be a lot of weeds, this and that, whatever
In a
else. So
bucket.
if you're in buckets.
Is a bucket
But in
considered
your
a
front
raised
yard?
bed?
Well, it
Well,
all
I think
depends, I
anything
don't
could be
know.
considered a raised bed.
I don't know.
Like,
It's just
if
something
you-
I'm
It does
thinking.
have
The
a
only thing I was
height, like,
looking
requirement
at-
was 18 inches, so like, you can't use a bucket that's higher.
Yeah, buckets pretty close to 18 inches.
Yeah, I guess so.
Isn't it more?
6-gallon bucket is about 18 inches, yeah.
Oh, really?
This is what
Yeah,
I was.
maybe higher.
Well, if it's higher, you can't use it. That's
Well, the
what I'm
plant
saying.
can then only be about that high. If you use it.
Like these things that people build, but like the bigger ones that, like those.
Oh, yeah.
That's a
yeah,
raised
yeah.
bed to me, like that's,
That, yeah, I
Yeah.
would agree with that.
That's a raised bed.
so I mean, that's up to you guys, whatever you, I'm just saying, if I saw this, I would say this is okay for my front yard.
I would rather have one like that
Oh, yeah.
than just the buckets
Oh,
all
yeah,
over
or
the
the
place.
tires,
Yeah.
yeah, I agree, but like the tires are considered, I would say that would be considered a.
But, you know, people put raised beds because they don't have room. So why can't they, if they have a limited backyard, put the raised bed back there?
Well, a lot of people have raised beds because they have difficulty bending over too.
Right.
You know, they don't wanna be on their hands and knees or whatever the case might be, so.
I don't think we should have raised beds in the front yards.
You know,
Period.
in a sense, people that would take care of them, I think they would look fine.
That's a big thing.
But
That's what it all comes
that's
down to, is
what
taking
it comes
care of
down
things.
to, is you're gonna have some people that are just gonna,
Well, the thing is
Do whatever.
a handful of people opened up a can of worms. That's the whole thing.
Right,
They
exactly,
don't take care of the gardens they have, but they continue to put it in their front yard.
yeah.
And
And like the
They
ones
just ruined
on
it for
Spring
everybody.
Street that we always talk about, those metal ones, like that's considered a raised bed too, if you Google it.
sure,
So, I mean, to us it's not, but
See, but then you have on the corner of Geneva and Fifth Street, they have raised beds and it looks.
Oh, it's beautiful, yeah,
It's one of the
absolutely, yeah.
nicest
But
Looks
theirs is
beautiful.
not in the front yard anyways.
Yeah,
But
yeah.
even- but if it was-
Consider front yard, cause they're the corner.
what's their
But
address?
their house is on, like, faces Fifth Street.
Front yard
Or-
consists of the front corner of the house forward.
So what about like Elm? He has the whole side yard. Is that
The
considered
front,
a
the
side
front yard
No,
is
not-
determined by the
Front
front corner of each house forward.
So by that definition,
Right.
anything on the side of the house is
It's not a
fair
front
game.
yard.
Right.
Even if it's, so the one on Elm, right by the,
Fire
Where's the front of the
station.
house,
Fire station.
front of the house pointed
no,
at?
not the fire station, that's Elm Court,
Oh, all the way up on
all the
Elm,
way
okay.
up on Elm. What
That's
about
on the
that one?
side, isn't it?
that's on the
still-
side of his house, yeah.
But it's in the front yard.
Well, it's the side
The
though, because
front-
it's from the front piece back. So like it's not in front of his house. Am I thinking about the same one?
I think part of it is on the side and part of it is in the front, on that one on Elm
Yes, but
Street,
it's taking
yeah.
up that whole yard.
Yeah, well, if
So
it was the
that's-
whole side yard,
It's
as
the
long
whole
as
side
it
that's
wasn't,
not-
That's, side yard's
It's
not
in
front
between,
yard.
like,
right,
10th and 11th
Which
Street,
the
I
one,
think.
Yes.
somebody just
Why
put a
not?
fence up too, didn't they? Somebody just put a fence up.
yeah,
That's on
Maplewood.
Maplewood.
But that reads
But
the
it would
same
still
way.
have to, even if it's inside the fence, it would still have to go by these guidelines.
Mhm.
Right.
I think, I liked what you wrote, what you guys came up with here, I went over it. And I think it's a good starting point, and if we can control some of these with this ordinance, then that's great. If it's not controlling some of these things, then maybe look at it again.
We can
and
amend it
tweak
later on
Yeah.
if
But I think this
we're
is-
running into problems.
Yeah, but I think this is something to kind of finally put it to bed and to kind of
Yeah.
get something on the book so that Billy can,
I would still take out containers. Personally, planters, that's obviously for a plant, so like, that's fine. But containers is like,
Who
I think a
mentioned
gray
tires?
area, yes.
Who mentioned that?
Me.
'Cause
Where's
that's-
containers
Is
at?
that on there?
No,
That should be added to.
Yeah.
because there are
C2,
people that plant in
C.
tires.
Right,
I
Oh,
don't think that
containers
should
or
be in front
planters.
though.
so you would say just planters as opposed to containers, is that
I
what you're
would,
saying?
yeah.
Oh,
Okay.
you even would say planters, or you just
I mean,
said
I would take out
raised
containers
beds?
for sure.
Yeah, cause
And then-
planters can be, I mean, planters are typically,
Decorative pieces.
Yeah.
I mean, in a sense, yeah, I mean,
Um,
more so than a bucket.
Yeah.
I guess.
but like, we were just saying, like with the like there are people that they spray painted tires and planted stuff in the tires in their front yard. So like, is that gonna be like, if Billy goes there, they're gonna say, well, this is my raised bed.
but there's some on Butler and Hopewell, where they do use tires, but they look appropriate for their yard. They don't look like junk, but then there's some that have junk in their tires.
Yeah.
It's hard
Ricky,
to.
you act like we're lying about this, this is like
No, I know, but
factual.
I know,
How about the toilets?
Yeah, I mean, we've
There
seen
you
people
go.
plant stuff in toilets.
yeah.
I think that was actually on Elm at one
I
point.
think it was.
I think we're giving people ideas.
I know.
Yeah,
Mhm.
but I think that it needs to stay like very specific, so there's not a gray area.
When we
Well, I guess it has to be aesthetically pleasing.
Yeah, I mean, but then it's gonna say who's.
But that's vague.
Yeah, who
Yeah.
gets to
And
determine
who's
that?
gonna determine that? Right.
It could
That's
be,
why I don't want these things in court. Not front yard gardens, they could do administrative citations, but I don't think it should be, something that should come into court. That's just my thoughts on it. But you guys are the boss.
I don't think any more people are gonna make front yard gardens than what are out there now.
I don't think so.
We have
either. But I think
10, if that,
Yeah.
what would happen, so.
It's mainly to make sure people clean up
Yeah,
their
it keeps
front
them
yard.
in
The gardens that they have,
And
yeah.
if you go past the ones, some of them aren't,
Not taken care of.
like right now, it's all dead plants in the front yard.
Mhm.
Well, I think you
So-
put on there that it has to be.
Right, and
Yeah,
I mean, that's
maintained, yeah.
probably more important than, containers or whatever, but as long as the height's there, the 18 inches too, so you can't go, above that.
I'd say with that and the maintenance, we could start there and then
Yeah, I mean, it's just
See
your
how it goes.
basic things to kinda see.
see the pushback we get and how we could control that and go from there.
So really, we're only changing the container. Does that sound okay?
Good for me. I crossed it out already.
Alright, well, thank you, we're gonna let it go to 3 readings and go from there.
So we're gonna bring it out
Bring it out next week?
We'll bring it out next week.
in caucus?
Yeah.
Okay,
Is that okay?
It'll be
Yeah,
an
that's fine.
add-on then.
it'll be an add-on,
Okay.
unless we bring it out tonight and have it, and just have the paperwork ready next week, but what do you think?
Can you do that?
I mean, we can, but you're already adjourned from your,
No, I'm not adjourned at all.
oh, you're not from
No.
your adjourn, oh, well,
Oh,
yeah.
no, we're still in finance and legislation.
I would just have to get you a,
Let's face the title page, right?
yeah.
Can I just read off of this one while you're doing that? All right. We will have an ordinance creating 1397.17 of the codified ordinances of the city of Struthers to permit and regulate front yard gardens. Motion to bring it out.
Make a motion.
I will second that. So that'll be on next week's agenda.
Okay.
And if if something comes up, we can just table it then.
Right, send it back to committee.
Okay. Anybody have anything else for this committee?
That's good, after 2 years, we got it.
Motion to adjourn.
Second.
2.
I think it's pretty.
I'll make a motion, I'm sorry.
Okay,
Make a
I
motion.
will second that.
Okay. you'll
Two's
second.
Meeting
long
adjourned.
enough.
Or whatever, we started talking about it, and we started talking about it about 2 years ago
Move the
again,
red
and
button.
Yeah,
we
right.
finally got it going consistently in the last.
Well, yeah, we'll have something on
I
the
think
Sorry
you
about
guys
that.
you all have my office contact, and I think you should all have my cell phone, if not,
Mhm.
Megan has it, if anybody has anything additional
Bye.
on the budget.
Alright.
See you, John.
Feel free to reach out to me or the
I
mayor.
do have the amended, I have the amended, I printed out for everyone.
Are we still on here, on the owl?
What's that?
Are we
think
still
so.
on here?
Yes.
Bye, Freely.
See ya.